Mark Gentilozzi and Fred Lione, president of the Norwalk Hospital Volunteers. A lot of personal stories you've been sharing with us during the break. Fred, tell us a little bit about some of the things that you've encountered as a volunteer.
Well, one of the most touching things for me is the flower distribution system. As you recall, I said that I did the delivering to the rooms. More than once, I've delivered flowers to a room of a very sick patient who is not long for this world. And I put those flowers on the windowsill, and I get a reaction from the person, just a little reaction. And you know, I think that's the last living thing this person may experience. And it lifts this, I don't mean to over-dramatize it, but it lifts what we do in the Blue Jacket to a level that you don't expect when you sign up to be a volunteer. Go out in the hall, frankly, and you have to kind of recover a little bit from
simple acts
from that. Yes, it's just
kindness,
just
little beauty into
exactly. And you know, the stores locally contribute, 3 or 4 of them contribute those flowers to us, and it's a very touching, moving thing for me.
That's a great story to share. I have to say, my personal favorite program that I have a lot of contact with is the pet therapy program. As a pediatrician, and I actually work on the inpatient pediatric unit at the hospital, I can tell you, I can't even describe to you the joy on the faces of the patients, the parents, the staff, when the dogs come around. Can you tell us a little bit about that program?
I can, Vicki. It's a wonderful program, the pet therapy program. I believe it's been at the hospital for about 10 years, and I know that you've had the folks on your program. One of my personal experiences.
The animals upstaged everybody else.
Oh,
absolutely. And they're there for everybody, staff,
the
patients, the volunteers, everyone. It's just great. Yeah. One of my personal experiences was walking into a room, a patient had a heart monitor on, you could see their heart rate. And as soon as she saw the dog, you could see the heart rate monitor actually dropping. It was just a smile on her face. She just seemed calm, and you know, the dog went up, put its head on the bed, and just rested there, and she was able to pet it for a couple minutes, and just a great program. It's nice to see. I think it helps everyone. I think it brings a little calm and a little joy, you know, in overall hectic days for staff as well too. It's just a great thing.
Yeah, I think I agree with you. I couldn't agree with you more, because, as I said, I experience it on a personal level as I work on the unit, and the staff look forward to the visits. Not just the patients don't know to expect it, but the staff know, yeah. And that joy that's brought into the whole unit is really remarkable.
We've discussed or mentioned several different programs that the volunteers run. I think we ought to get some idea of the gamut of programs that you're involved in. Sure. But we mentioned the flower delivery program, therapy program, the ambassador program, transportation. What other activities do the volunteers?
For people who don't want to be as close to patients, there are clerical jobs in offices that many of the volunteers do. There's the emergency room, both inside the emergency room for people who are comfortable with working with patients very close to doctors, outside in the waiting room of the emergency room, which, is, you can imagine, can get extremely hectic. So there's a full gamut. GI, they check them in and out of GI. They restock the bins of whatever it is in GI. If you've ever had a colonoscopy, you'll see the people buzzing around. So it's infinite in range. You can be as close to the patients as the emergency room, and you can be as far away from them as filing in an office away from the patients.
If someone's interested in becoming part of the volunteer program, is there a minimum they have to work? And then how do they get in touch? How do they get into the program?
Well, they can contact the volunteer department, and I think there should be. I think there's a minimum they like to 6 to 8 hours a week, and it's very doable. There's so many things there to do. If you're not sure, talk to the volunteer group, and there's something for everybody at the hospital. What do you want to do?
Are there seasonal volunteer options, Mark, as far as students or, I know I get a lot of questions being in the community that I field to Maura Romaine, who heads our volunteer department, with regard to graduating seniors from high school or college students that are home for the summer that might want to volunteer a finite portion of time, because obviously they're going back to school. So we do accommodate people like that with those
Yeah,
needs.
but they have to make a time commitment because we have the criminal check, and they have to get the TB scratch tests, and then wait.
Correct.
So there are a series of things that take 2 or 3 weeks to accomplish. So if a person comes in the end of June, we can't get them online until the end of July. It doesn't make much sense.
And that's important for folks to know. I agree with you, and that's something that that's transparent to them, but obviously is so important if you're going to be working in a hospital
I
setting.
was just going to ask Mark, are you trained at the beginning also so you know what you should and shouldn't be doing in a hospital with infection control and some of those other
And
things?
Yes,
privacy concerns as well.
Yes, an orientation that every volunteer goes through, both on, there's some papers, some reading, and also training. And I think that once you start the program, you should take it seriously. It's very flexible. If you're not, if like for in the pet therapy program, when I was doing that, I found it very difficult at times because of my mother's illness and my brother's illness to work in a certain area. They always find something for you to do there. So there's a lot of flexibility, but you should take it seriously as far as the time commitment. But it's not a huge amount of time. You could always work it into your schedule somewhere along the way.
Now, not all of our viewers are in the Norwalk area. Do all hospitals have volunteer programs? And
Yeah,
so
for the most part, I believe. Yeah, Stanford certainly does.
so that anybody at home who's sitting in Greenwich or up in Woodbridge who's interested, they can contact one of their local hospitals and find out about
But many of our volunteers are from Wilton, Westport, Weston, some from Darien, New Canaan.
And we'll certainly take people from Woodbridge and Greenwich.
Of course, of course, yes.
What do you get out of volunteering yourself?
Well, selfishly, it makes me feel good. I mean, it's a terrible thing to say. Why do I do it to
No,
make myself feel good? But it does. It makes you feel like you've done something that helps somebody else. And I think as you get older, in my own case, you become more conscious of mortality and involvement with your fellow man, and the little things that may have bothered you in your 20s or 30s or 40s that don't seem to bother you in your 70s.
Yeah, I'm learning that in my 60s.
Yeah, and so I think that the biggest thing is the self-satisfaction, and that sounds self-serving, but it really gives you a warm and fuzzy feeling.
My feeling is, I think when you look at your day-to-day life and you think, oh, this is difficult, that's difficult, you realize after a day of volunteering that there's true hardships out there and people are dealing with a lot of problems in their lives, and maybe yours aren't so, maybe your problem, what you thought was a big problem, isn't. That's the thing that I kind of walk away from. And that's one of the things that was nice when my daughter did it. Sometimes kids at that age, 19, 20 years old, they think the world revolves around them, and then they see what's going on in this world, and they have a better outlook.
And we have to close on that note, unfortunately. But I think I want to thank you for what you do. I hope our viewers outside who are watching understand just what a wonderful thing they could do. And I think, again, it's a wonderful thing about us as human beings that we demonstrate the best of us. And
thank you very much for having us on.
Thank you, Doctor.
So when we come back, we'll have this week's health question.
Here's this week's health question.
Hi, my name is Maxine, and my question is, what are the signs of dehydration?
That's an important question. I think most of us think about dehydration when we get thirsty, but severe dehydration actually can be life-threatening. And that's because water is an important part of our blood, and if we get very dehydrated, actually the volume, the actual amount of blood in our blood system, in our circulatory system, decreases, and you can have trouble getting blood to your brain and your heart. Particularly a problem in the very young and the very old, and we have an expert in the very young.
Absolutely. I can tell you as a pediatrician, children are very much affected by dehydration. Some of the signs, the earlier signs would be just lack of energy, listlessness, and the other signs that we specifically tell parents to look for are decrease in urine output. If it's an infant, less wet diapers than what you would normally see. And no tears when they're crying, listlessness, lying around and not really responding.
And kids who are having diarrhea or a lot of nausea or vomiting, aren't they the ones at risk?
They are highly at risk, and so we encourage parents to seek the help of their pediatrician when those processes are unfolding so that they can get to the appropriate care in a timely fashion.
And in older adults, again, middle-aged folks, young people, we feel thirsty. We really should go out and get the water that we need or the salt that we need to replenish our fluids. But in the very elderly, they can faint. So fainting can be a sign of dehydration, and certainly low urine output, and all the way to loss of consciousness. So dehydration can be a very important problem. The severe heat of the summer, you have to worry about people getting dehydrated from sweating. And again, it's the people that have trouble getting water when they need it, getting fluids when they need it. I wish we had more time to talk about that, but we don't. So if you have a question you'd like to ask on Health Talk, please contact us at healthtalk@healthtalk.org.
We would like to thank our guests today, Fred Lione and Mark Gentilozzi. Stay tuned, and we'll see you next week on Health Talk.
Stay well. And if you can volunteer somewhere, it's a good thing to do.